Okay, let's talk about contraception. I mean, there are so many options out there, right? It can feel, well, pretty overwhelming. So in this explainer, we're going to break it all down. Our goal is to give you a really clear guide so you can feel confident and empowered in your choice.
And that really is the big question, isn't it? With just dozens of methods to choose from, where do you even begin? But don't worry, we've got you covered. Think of this explainer as your personal roadmap. We're going to navigate this whole thing together.
All right, so let's get right into the nitty-gritty. At its core, contraception is all about timing. See, an egg can only be fertilized for about 24 hours after ovulation, but sperm, they can hang around for 48 to 72 hours. It's this specific biological window that every single method we're about to talk about is designed to address.
So here's our game plan. First, we'll kick things off with the basics, natural and barrier methods. Then we'll dive into all the hormonal options. After that, we'll look at the super effective long-acting methods and even touch on permanent surgical options. And of course, we'll wrap it all up by talking about how to actually make the best choice for you.
Okay, first up, let's talk about the methods that really require you to be hands-on and on top of things with each use. We're basically talking about two main approaches here: working with your body's natural cycle or creating a physical block.
So when we talk about tracking fertility, there are a few ways to go about it. You've got the calendar rhythm method, which is all about predicting your fertile window based on your cycle length. Then there's tracking your basal body temperature, or BBT, looking for that tiny temperature spike after ovulation. And finally, you can analyze changes in cervical mucus. The big takeaway here, all of these demand serious consistency. And you have to remember, simple things like being stressed out or getting sick can totally throw off your accuracy.
Now let's look at a head-to-head on barrier methods. On one hand, you have the penile condom. Super accessible, no prescription needed, and, this is a big one, it's one of the only methods that also protects against most STIs. On the other hand, you have the diaphragm. Now, this one needs a prescription because you have to be fitted for it, and it doesn't offer STI protection. It's a different kind of tool for a different set of priorities.
All right, so we've covered methods that work on the outside. Now let's shift gears and talk about options that work from the inside out. This is the world of hormonal contraception, where we're actually using hormones to prevent pregnancy systemically.
So you might be wondering, how do these hormones actually work? It's pretty fascinating, actually. They have this two-pronged attack. First, and most importantly, they suppress ovulation. Basically, they tell your body not to release an egg. No egg means nothing for sperm to fertilize. And then, as a sort of backup plan, they also thicken your cervical mucus, which makes it way harder for sperm to even get through.
The cool thing about hormonal methods is that they come in all sorts of delivery systems, and this really comes down to what fits your lifestyle. You've got the classic pill, which you have to remember to take every single day. Then there's the patch, you change weekly, or the ring you only think about monthly. And for those who want to think about it even less, there's an injection you get just every 11 to 13 weeks. Same basic idea, just a different schedule.
Okay, but what happens if something goes wrong? A condom breaks, or you forget a pill. That's where emergency contraception fits in. It's super important to note this isn't a regular go-to method. It's a backup plan. The morning after pill works by hitting pause on ovulation. But there's a catch. It's a race against the clock. You have to take it within 72 hours for it to work.
All right, now we're moving into a category that has been a total game changer in contraception. I'm talking about long-acting reversible contraceptives, or LARCs for short. When it comes to effectiveness and convenience, these are basically the set-it-and-forget-it champions. Just look at that number, over 99% effective. I mean, let that sink in for a second. That's why LARCs have become so popular. Once they're in place, there's nothing for you to remember to do. You take human error almost completely out of the equation, and what you're left with is a method that's about as close to foolproof as you can get.
But LARC isn't just one thing. There are options here too. You have the hormonal IUD, which can last for 3 to 5 years and often makes periods lighter or even makes them disappear, which some people love. Then there's the copper IUD. This one is totally hormone-free and can last for a decade, but a potential side effect is that it can make periods heavier with more cramps. And finally, there's the implant, which goes in your arm, lasts for about 3 years, and works by stopping ovulation, but can sometimes cause irregular bleeding. So it really comes down to personal choice. Hormones or no hormones, and what kind of effect on your period you're comfortable with.
Okay, so far everything we've talked about is reversible. But what if you're absolutely certain that you're done having kids or that you don't want them in the future? That brings us to our next category, permanent surgical methods. This is the definitive decision.
So let's compare the two main options. For people with fallopian tubes, there's tubal ligation, where the tubes are cut or blocked. The big thing here is that it's effective immediately. For people with a vas deferens, there's a vasectomy, which is generally a simpler procedure where the tubes that carry sperm are sealed. But, and this is really important, it's not effective right away. It takes a while and a few follow-up tests to make sure the coast is clear, so to speak.
Phew. Okay, we've covered a ton of ground, from daily pills to 10-year IUDs, so now we get to the most important part of this whole conversation. With all these options, how on earth do you choose what's right for you?
I mean, after hearing all of that, it's the question on everyone's mind, right? Just tell me, what's the best one?
And here's the honest answer. There is no single best method. There just isn't. The best choice is the one that is right for your body, your health, and your life. It's all about finding the perfect fit for your unique situation. So as we wrap this up, let's just nail down the key takeaways. Number 1, effectiveness varies a lot, so you really need to pay attention to those numbers. Number 2, only condoms can also protect you from most STIs. That's a huge deal. Number 3, your lifestyle and your health history matter. What works for your friend might not work for you. And finally, and this might be the most important point of all, talk to a healthcare provider. They are your absolute best partner in making this decision. So, think of this as the landscape. We've laid out the map of all the different paths you can take, but ultimately, you're the one in the driver's seat. Our goal today was just to give you the knowledge you need to make a truly empowered choice. So the final question is, what does that empowered choice look like for you?